Let me end with a short story that could be added to the wall of shame. Back in the late 70s, I had a good friend who was an organizer in the Madison area of laundry workers. He was totally dedicated to his work. He was always working, immense energy, dedicated to the people that he was trying to help. He kind of fell on hard times in the 80s, the 90s, and after that. He sort of bounced around from one job to another. And in those jobs, very seldom had health insurance. He finally did, about 3 years ago, get a job that was better than he'd had before and that provided health insurance. And so one of the first things he did was to go in for a physical, which he hadn't had for about 10, 12 years because he couldn't afford it. He found out that he had advanced prostate cancer. That is something that would have been picked up in a regular exam if he had had health insurance. So he didn't. As a result, found out that he had incurable cancer. Jim died about 2 years ago. And yet it wasn't really so much a result of that cancer. It was a result of our unfunctional, broken healthcare system in this country. Jim didn't need to die. Nobody who dies because of a lack of access to health care, because of a lack of access to health insurance, no one should have to go through that. And we should not allow that to happen in America. There's no reason why it has to happen in America. That's why all of us have to keep our energy in this fight and make sure that this country and that our representatives in Washington do the right thing.